Thank you.
Live.
A very good afternoon to all our viewers. I, Dr. Siri Kamath, Senior Consultant Physician and COVID Task Force Co-in-charge of BGS Gleneagles Global Hospital, would like to welcome you all to today's program, Managing Pregnancy During the COVID-19 Pandemic. To take the discussion forward, with me today are Dr. Nirmala, Consultant Obstetrician and Gynecologist. Hello, Dr. Nirmala.
Hi. Hi, Dr. Siri.
And Dr. Sandeep HS, Consultant
Hello.
Interventional Pulmonologist and BGS Gleneagles Global's COVID-19 Task Force Co-in-charge. Good afternoon, sir.
Thank you, madam. Thank you. Hi.
Across the world, people of all ages and from all walks of life have undergone significant hardships because of this disease. Not only directly because of the disease, but because of the disruptions it has caused in the delivery of healthcare services. Especially affected by this pandemic are pregnant women and newborn children, who have not only suffered the consequence of the disease, but also pregnant women have undergone great difficulties at the time of delivery and even during antenatal period because of the lack of easy access to healthcare services. So our program today is aimed particularly towards pregnant women, the questions that they may have pertaining to COVID-19 and their pregnancy and various stages of pregnancy, such as the delivery and the postpartum period also. To start off the discussion today, Dr. Nirmala, this is a very pertinent question asked by one of our viewers. Are pregnant women at higher risk of developing COVID? And what are the changes that you've had to make in the way you deliver antenatal care to pregnant women during this COVID-19 pandemic?
Pregnant women are not at increased risk of developing COVID infection as against the general population. In case the patient comes in contact with a COVID positive patient, then she is at risk of developing the disease. Also, regarding the antenatal visits, the frequency of the antenatal visits should be according to the gynecologist's advice, especially for high-risk pregnancies like gestational diabetes mellitus, pregnancy-induced hypertension, and others. So, Dr. Siri, I have a question for you. What are the respiratory changes that happens in a pregnant lady, and how is it pertinent to this situation?
During pregnancy, the woman's body undergoes great changes to accommodate the growing fetus as well as the increasing mass of the reproductive tissue. Particularly the circulatory, the cardiovascular, and the respiratory systems have to adapt to meet the metabolic demands of pregnancy. So, starting from the nose, that is the upper respiratory tract, and down to the lungs, the diaphragm, and the ribs, there are many changes that we see in the respiratory system. Due to increased blood flow to the upper respiratory tract, what happens is the pregnant woman may feel nasal stuffiness and sometimes even bleeding from the nostrils. And as far as the lower respiratory tract is concerned, progesterone, a hormone which is key to maintaining this pregnant state, induces an increased respiratory drive, which means that the pregnant woman would be taking a larger volume of air during each breath. So this can lead to a sensation of what is called as air hunger and a subjective sensation of breathlessness in the pregnant women. So this symptom is seen in up to 60 to 75% of pregnant women. It can start as early as the first trimester, continue during the second trimester, but become stable during the third trimester. So these normal phenomena can be mistaken by pregnant women to be something abnormal. So the next question that we would like to ask Dr. Sandeep is, does pregnancy predispose a woman to more serious disease? Dr. Sandeep, the question asked to you was, does the pregnant state predispose a pregnant woman to more severe COVID-19 disease?
See, I don't think so. Actually, we have observed H1N1 pandemic as well in 2009. As compared to H1N1 influenza infection, COVID has been kind enough to spare pregnant women and children so far. I don't know what is going to happen in the third wave or so-called third wave. But as far as the first wave and second wave are concerned, I think pregnant women are not at a very high risk of neither developing the infection nor the severity of infection. In fact, I would say See, basically, pregnancy is a state of immunocompromise. Okay, basically, it is a state of immunosuppression. I think that is something which is protecting the pregnant women from getting severely infected as compared to male counterparts. Okay, as well as non-pregnant women. So I think that is something which we have observed over this past 1.5 year. Pregnant women are neither at increased risk of infection nor the severity of infection is high. In fact, I would say it is less as compared to general population. Here and there might be minimal worsening in the oxygen saturation, but majority of the people have recovered back to their normalcy, and they have resumed their pregnancy, and they have continued to deliver as well. I think that is what is our observation.
The next question is to Dr. Nirmala. Again, from our viewers, a very pertinent question has been asked. What is the impact of this disease on the fetus, and is there any chance of increased adverse outcomes of pregnancy because of this disease?
According to various studies, Dr. Siri, there is no increased risk of teratogenicity in the fetus. That is, the fetus is not at increased risk of congenital anomalies. Also, there is no increased risk of pregnancy complications like the first and second trimester abortions, preterm labor, and intrauterine deaths. So that is one good thing for the general public. There is no increased risk of any of these complications just because of COVID infection. So, Dr. Siri, I just wanted to ask you, can you just brief us about the symptoms in a COVID positive patient and what are the medications you would advise for them?
So the symptoms in a COVID positive pregnant women are more or less the same as the general population. Fever, there can be nasal stuffiness or runny nose, cough. Most of the time it's dry cough, but sometimes it can be wet cough also. Minimal sputum with sometimes blood-stained sputum also can be seen. So in an otherwise healthy pregnant woman, the treatment for these kind of mild symptoms is quite straightforward. She can use paracetamol for fever or body ache. She can use antihistamines such as cetirizine or chlorpheniramine maleate for nasal stuffiness and sore throat. Cough syrups containing dextromethorphan can be used sparingly. If she has too much of nose block also, she can use saline nasal sprays. Plenty of rest and hydration also is part of the treatment strategy.
Yeah. Dr. Sandeep, one question for you. So how do you decide if a COVID positive pregnant woman needs home monitoring, and how frequently should she monitor these parameters at home?
See, the decision is solely based upon her symptom severity, the days since the onset of symptom, and most importantly, it is the pulse oximeter reading. I think it is purely based upon oxygen saturation. There is no difference between a non-pregnant counterpart as well as a pregnant lady. We analyze everybody in the same way. So whoever has got a lesser saturation, somewhere between 90 to 92 or below 93, they are the ones who will usually require admission. Other than that, majority of the people whomever I have treated, at least, I mean, out of 100 pregnant ladies, I think we are able to manage 90 out of them at the OPD level only. That means at home monitoring level only. And monitoring is, similar to what we do in other patients as well. So once in 6 to 8 hours, pulse oximeter reading, they keep on updating us. As long as it is above 94, we continue to keep them at home and continue to treat them. If at all it falls below 93, then we call them upon for the hospital and give them the admission. So monitoring is purely based upon pulse oximetry levels. If it is above 93, don't worry, they can stay at home. They can be continued to be monitored at home. Okay, if it is less than 93, then they might require admission.
The next question is to Dr. Nirmala. In what way is the obstetric management of a COVID positive mother different from a COVID negative mother?
In a COVID positive pregnant patient who has completed 9 months of pregnancy, either induction of delivery or cesarean section is decided purely on obstetric indication. Suppose the baby is having fetal distress or reduced fluid around the baby, or say previous cesarean section, then we call it an indication for cesarean or normal delivery. But as such, COVID positive status per se is not an indication for induction of delivery or cesarean section. So, Dr. Siri, I just wanted to ask you, when do you advise hospitalization in this COVID positive pregnant women? Most of them want home monitoring. Now they are at home, and what are the symptoms that should drive them to the hospital?
For an otherwise healthy pregnant woman who has no other comorbidities, the indications for hospitalization still is an oxygen saturation of less than 94%. However, if she has some unmanageable symptoms, that is excessive vomiting or diarrhea or very high fever, and she is dehydrated, not able to take anything orally, that is a lesser indication for admission to the hospital. However, if she is a person who has significant comorbidities, such as she has severe anemia or she has diabetes or pregnancy associated hypertension or some significant cardiovascular disease, then also the threshold for admission becomes lower.
Okay.
Dr. Sandeep, once the patient gets admitted, what is the role of CT scan or chest X-ray in diagnosing or assessing the severity of the illness? And if at all the woman lands up in the ICU, what are the treatment strategies available to us for treatment of pregnant women in the ICU?
See, basically, I want to make it clear the role of radiological investigations in the management of COVID-19 infection is very, very minimal. Because we cannot go on repeatedly doing those radiological investigations to monitor, because the disease progresses, okay, I mean rapidly, more or less. I mean daily changes will be there, okay. This progression in the disease can be easily monitored with the pulse oximetry. And if you consider pregnant women, I would say I would not even get a single chest X-ray also, if at all I know that it is a COVID-19 patient. And my entire management, decision making, treatment administration, everything would be based upon serial pulse oximetry monitoring only, not on any kind of CT scans or not on any kind of even chest X-rays. I think it is not required. Okay, if it is going to add anything to my management strategies, then I would do it. But in COVID, when you know that the case is already COVID, and when you know how it progresses, it is the easiest way to do, safest way to do monitor the patient is purely based upon pulse oximeter readings. So no chest X-rays, no CT scans required. I think, I don't know whether, have you come across anybody who have got CT scan done in pregnancy?
Not
Yes,
so.
in fact, when the patient needs intensive care admissions, in fact, when the pulmonologist or the intensivist advises, so we do say, okay, please go ahead, because the benefits outweigh the risk in this condition. And also we tell them to use the abdominal shielding just before doing the X-ray or the HRCT. Of course, there is risk of radiation exposure to the baby. That is explained to the
But
patient.
I would say, I think, madam, the thing is, what additional information are we going to get by doing a CT scan? Should be the question. Is it going to, make me change my treatment plan? Is it going to make me add any drug or any mode of therapy? That is not there. I think, entire management is based purely upon oxygen levels, and the treatment administered is same. Either the patient is having a CT score of 25, 20, 13, it doesn't really matter, as long as the saturation is well within the normal limits, or maybe whatever saturation, if it is 80, that clearly indicates that there is involvement of the lung, and the involvement is extensive only. Okay, so in that way, if at all I have to give my final comments on this radiological investigations, I don't think they are very useful in COVID. I think, COVID, it is a clear-cut viral infection, respiratory illness causing hypoxia, and hypoxia is monitored exclusively by pulse oximetry. That's all. If at all the treating physician, as you said, as an intensivist, if he wants to take some additional information in the form of maybe a mediastinal emphysema or maybe a pneumothorax or something like that in severe cases, I think that is the time when we might have to consider CT scan. Otherwise, on a routine basis, I don't advocate or neither I advise any kind of radiological investigations. That is first thing. And coming to the second part of your question, so you asked me regarding the ICU management of pregnant women, right? The management doesn't differ. I think we will be much more conservative in administering the drugs. As you all know, steroids are the main weapons against this COVID-19 pneumonia. And steroids are relatively safer in pregnancy. They bring about, in fact, a better lung maturity in the newborn, the fetus as well. So I think steroids are the mainstay. And as far as remdesivir is concerned, I think it falls under group C. Group C? So the remdesivir can also be administered in pregnant women. Other than that, we have not tried any kind of newer drugs like tocilizumab and all those things in pregnant women, because most of them go to a certain level, they start and after giving steroids, majority of them improve. I think that is the treatment plan what we usually follow in our ICUs.
Thank you, Dr. Sandeep, for clarifying that. Next question is to Dr. Nirmala, practically oriented question by one of our viewers. What COVID-related precautions do you take in the labor room as well as during cesarean section?
We at BGS Gleneagles Global Hospital have a separate labor room and operation theatre for COVID positive patient. Now, in the labor room, as before, we are not allowing the relatives or the attenders to stay with the patient, that is a delivering patient. In the labor room and the operation theatre, we follow strict precautions related to COVID, like safe distancing, social distancing, using PPE kits, masks, and we also restrict the number of people who are inside the operation theatre. So there is no need for people to be concerned because they're coming to the hospital, they think that they are at high risk of developing COVID, but we are following all the precautions stringently. So there's no need for concern. So Dr. Siri, the next question I just wanted to ask you, how would the newborn acquire this infection? Is this in the antenatal period or in the postnatal period?
So far, many studies have been done to detect the virus in various body fluids. So, with relevance to birth of the child and delivery, the virus evidence has never been found in amniotic fluid or genital fluids, urine of the mother, or even the breast milk of the mother. So, it is surmised that probably the child acquires the infection during the process of birth or immediately after that, when it comes in contact with either a COVID positive mother or some other COVID positive person in its vicinity. So it's more of horizontal transmission. Vertical transmission, in utero transmission, has never been proven for COVID.
That's a really good news for the people. Anyway, Dr. Sandeep, I just wanted to ask you, what is the range of severity of infection seen in the newborns that you have treated?
I think newborns are, they just turned out to be positive. If they are born to a COVID positive mother, I think it is a routine to do a nasal swab from a neonate, and they turn out to be positive. Majority of them are asymptomatic. We have none of our patients we have lost or something like that. No, most of them are asymptomatic. I think we should allow the normal physiology to go ahead. I think both the kid and the mother should stay together. I think initially, at least, we had some misconceptions, or maybe we tried to separate the mother as well as and the baby. But now I think with solid evidence that neonates are hardly being affected, I think we should allow the child to be with the mother and receive the care and the nutrition, whatever it deserves after being born.
So
the final conclusion is neonates are not very severely affected. So no need to separate the neonate from the mother who is who has given birth to that child.
Talking about the care that a newborn deserves, Dr. Nirmala, what are the precautions that a COVID positive mother should take while she's caring for the baby, and particularly while breastfeeding? And also another question sent in by our viewers is, what is the role of artificial formula foods in the immediate postpartum period?
Yeah. COVID positive mothers can still breastfeed their baby, taking proper precautions, safety precautions like hand hygiene, frequent hand sanitization, wearing the face mask, and even breast hygiene also. But suppose the mother is having a severe cough, or say she needs intensive care, then the baby may have to be separated from the mother, and artificial formula feed comes into picture. So that also has to be done under strict asepsis. That's very important, so that baby just doesn't have gastroenteritis in the first few months after delivery. Dr. Siri, prevention is better than cure. Now the talk of the day is vaccines. So all of them want to know what are the vaccines that are available in India, and also are they safe to be given during pregnancy?
During pregnancy, as the fetus is growing, it is still, even though it is growing, it does not have a very strong immune system. So from the very beginning, pregnant women have not been given live attenuated vaccines. For example, MMR. MMR is a live attenuated vaccine, so it is to be taken before pregnancy, not during pregnancy. However, there are some diseases that the pregnant woman as well as a newborn baby deserves to be protected against. That is things like tetanus, diphtheria, and pertussis. So, since this particular vaccine is an inactivated vaccine or a subunit vaccine, it can be taken by a pregnant woman. Now, the vaccines that are available in our country, one is Covaxin, which is an inactivated vaccine, and the other two are Covishield and Sputnik V. Now, these two are non-replicating viral vector vaccines. That means even though there is it is a harmless virus which acts as a carrier for the spike protein to be delivered to the body's immune system, but this virus is not capable of replicating within the body. Of late, in many countries, pregnant women have taken vaccines, and the registry maintained has proven that they have not faced any major adverse effects of vaccination. Even the WHO has come out with some guidelines stating that if a pregnant woman feels that her risk of developing COVID-19 is very high, and on counseling about the available vaccines, if she is convinced that she would like to take a vaccine, then yes, it is an individualized decision that she can take for herself. The same thing is what we have heard of late is in Mumbai they have opened up certain vaccines and vaccination centers for pregnant women. So I think the answer to this question would be that the pregnant woman should have a detailed discussion with her healthcare provider, and if she is convinced or if she feels that she definitely requires vaccine and she wouldn't want to risk adverse disease outcomes for any reason near her delivery time, then yes, she should take a decision for herself whether she would like to take the vaccine or not.
That's really good. This is a very informative question that you have answered, because most of my patients do ask whether they can take it either in the pregnancy or during lactation.
So, Dr. Sandeep, what do you have to say about vaccination during lactation, and what precautions, or should a mother take isolation precautions after taking the vaccine if she is in the lactating period?
Yeah, I think ICMR has clearly mentioned, I think the government of India has clearly mentioned that the lactating women can be given vaccine. Okay, they can be vaccinated without any doubt. There should not be any hesitation in taking vaccination for all women who are lactating. Okay, that is the first thing. Second thing is, after vaccination, there are no isolation guidelines as such. I think you can continue to live your normal life. You can continue to feed your child, or maybe you can live your normal life. You need not get isolated or separated from the family or from the kid. You are free to live the way you were living the day before taking vaccination.
Dr. Sandeep, one question to you is posted by one of our viewers. Why has it been advised for pregnant women or lactating women to not take vaccination so far? I think what the person is indicating is up to now it was that way. What was the reason for that particular directive by the government?
See, basically, this vaccination drive which started in our country or maybe worldwide. See, till now vaccines were developed over a period of time. They were never developed at the pandemic level. Okay, so in COVID, what has happened is everything has come on a fast track. Okay, the research studies, whatever that number of phase 1, phase 2, phase 3 trials, whatever are there, they were all put on a fast track just because the pandemic was severely affecting the world. So initially, when a country like ours, with maybe not even a country like, whenever you are starting a vaccination drive worldwide, okay, you would like to leave out all those potential candidates who can develop some or the other kind of complications initially to kick off the vaccination drive. So that is why there were a lot of things there were a lot of people who were asked to stay away from vaccination, and majority of the normal individuals only were tried to vaccinate, were tried to be vaccinated in the initial period. As the days went on, as we went on getting the, evidences, okay. So the initial phase, whatever trials were there, they were only for 1 to 3 months. Then as we went on with the vaccination drive, and as the trials went on, so then we started getting a lot of information that there are no exactly vaccine related adverse effects happening in any particular set of individuals. So I can give you an example. See, there initially alcohol was not advised to be taken for 45 days. People were, I mean, there were all sorts of nonsense because the thing is, if an individual develops a complication related to alcohol, then that complication would be directly linked to this particular vaccination only. That would have severely affected the vaccination drive. People would have stayed away from taking vaccination. So that is why all these people on blood thinners, people on maybe who are having allergic reactions, lactating mothers, pregnant women, they were all kept away from the vaccination drive initially because we wanted to start a safe vaccination drive. Once people started getting confidence on the vaccination, that there are hardly any side effects because of vaccination, then everybody were, everyone was one by one, they started including everybody. People with allergic reactions also, they can take vaccination. The only thing is they have to be observed for a certain period of time. People on blood thinners could also be vaccinated. Even people can take alcohol on the same day of vaccination also. But I am not advocating it. But alcohol has got no relation with the vaccination as such. Okay, so that is why the pregnant women and lactating women were kept away initially. Then, as the safety data of the vaccination went on, when we started getting the safety data of the vaccination, then every group were included gradually. Similarly, the pregnant women also were, included in certain trials, and lactating women were also included in certain trials. And once the efficacy data, safety data was available, then it was made public for everyone.
The next question by one of our viewers to Dr. Nirmala is, what are the contraceptive methods that people can use during this pandemic time?
See, COVID positive symptomatic patients will be treated with various drugs, and I would personally tell them to avoid oral contraceptive pills or the birth control pills we call, because they might have drug interactions with whatever drugs they are already taking. But otherwise, barrier contraception can be safely used anytime. The rest of the contraception, there's no other contraindication.
The next question is
one question, ma'am. Don't you advise abstinence when the patient is COVID positive?
Sir, for mild asymptomatic COVID positive or mild symptomatic patients, I don't think we would advise abstinence for these patients.
Okay.
So the next question is it safe to get pregnant at all? Has been asked by one of our viewers in view of the severity of the second wave that was going on.
Yeah, this is a very, initially it was a very difficult question for us because a lot of people in the first wave came for medical termination of pregnancy. There were a lot of patients who had come for this. But then COVID pandemic is going to stay with us for some more time. With all the experience that we have, I think planning pregnancy and delivery is quite safe now. So I think it's not for any concern just to get pregnant.
And I think a continuation of the same question asked
I
by
think
somebody.
to add to it, I think those fears associated with getting conceived, maintaining pregnancy, delivering, and all those things. Initial days, it was there. I mean, when we are already 1.5 years down into the pandemic, and we know what exactly happens with pregnant women, whether we can deal with them in the same way as we used to deal them in the pre-COVID era also. So the thing is, as Madam rightly said, I would also like to second her opinion. See, it is more or less a natural course. It is just a viral infection. It has come as a pandemic. It is basically a respiratory virus. It will come and it will go. I don't think there are any long-term effects of this virus on the woman as well as the newborn which is going to be born. Okay, I think there should not be any fear. Getting pregnant or maintaining their pregnancy, nor delivering. I think that fear should go among the people. You can live the way you used to live in the past. Okay, past means I think before the entry of this viral infection. So be confident, be positive. I think more or less, we are. It is more or less similar to any other viral infection which usually comes and goes during pregnancies.
Thanks, Dr. Sandeep, because these are very reassuring words from your side. Because as soon as the patient becomes pregnant, the first thing the patient comes is with this question that are we safe? So these are very reassuring words.
Definitely, everybody is safe. Okay, provided, see, one thing is important. See, even if you get a COVID infection, see, not everybody will come to the hospital level. Not everybody will get into ICU. Not everybody will, die. See, out of 100 cases of COVID, still 90 are mild symptomatic only. Remaining 10 are the ones who require hospitalization. So if we catch them early at the right time, at that transition time from mild to moderate degree, and if we intervene at that particular level and give them appropriate treatment, even we can reduce the mortality. I mean, the morbidity associated with the illness, the financial burden, the burden on the healthcare, workers, as well as the family. The most important thing is if somebody gets COVID infection, you have to be vigilant. You have to monitor your own selves. You have to identify when you are worsening. If you are caught hold at the transition time or at the beginning of your worsening, and if we intervene at that particular time, I think it is as good as any other viral infection.
So I think we are coming to the conclusion of our program today. Many interesting questions were answered. It was a very informative session. Thank you, Dr. Nirmala and Dr. Sandeep. I think the take-home message is pregnant women need not be afraid that they're more likely to get the disease. Even if they get the disease, I think there is no need of excessive fear and anticipation that they will end up worse. They need not fear for the health of their newborn baby. Even if the newborn baby does get infected, children somehow seem to have some ability to get better with the disease. They don't succumb as much as adults do. Lastly, a woman who has given birth to a child can definitely care for her child and breastfeed also. As far as vaccination is concerned, lactating women can take vaccination without hesitation. But a woman who is pregnant who would like to take vaccine, she would have to take an individualized decision. So thank you, Dr. Nirmala and Dr. Sandeep, for clarifying all these key issues.
I
Thank
think
you
it
to
is a very good
everyone for
session. I
watching this.
think I should congratulate you both for taking the initiative and bringing it on board. I think this lot of things are associated, and the people are in I mean, lot of fear. I mean, what will happen? How are we going to tackle? What will, I mean, how will be the kid, whether it is going to get affected and all those things. Vaccination also, I think there are a lot of confusions. I think I should congratulate you both for coming up front and dealing with this particular major topic. I hope our people understand it. I hope our people come out of that fear, and I hope we will be back to more or less a normal way of living, accepting COVID as a part of our routine.
Thank you for your kind words, Dr. Sandeep. With that, we
Thank
conclude
you,
today.
thank you very much.